Tonight, precautions in Texas heightened as health officials closely monitor 50 people who came in contact with an Ebola patient. And an American journalist who contracted Ebola in Liberia is headed back to the States to receive treatment. Is it possible that this crisis is a little bit worse than we first thought? And can the CDC keep this under control? And we will hit the campaign trail where presidential hopefuls Hillary Clinton and Chris Christie, they're stumping for members of their own respective parties and helping raise some money in the process. Will this help push their presidencies or hurt them? Plus, voter registration in Ferguson, Missouri, it is up following the police-related death of 18-year-old Michael Brown. Why hasn't voter participation picked up in other black communities across America? Have the Dems missed their big chance to reel in more voters? Good evening and welcome to RFL. I am Richard French. Thank you so much for joining us. And tonight, we're going to start in Texas, where health officials now monitoring a group of 50 people who may have been exposed to Ebola patient Thomas Eric Duncan. Healthcare workers initially contacted about 100 people who had direct or indirect contact with Duncan or people close to him. Authorities say that Duncan also came into contact with 5 children who are all being monitored. This has prompted parents in the Dallas area to even keep some of their kids out of school. Hazmat crew working to decontaminate Duncan's apartment where he stayed before he was hospitalized. Meantime, a family living with Duncan has been quarantined and they are being monitored by public health officials. Duncan contracted the virus while he was in Liberia, trying to help a woman who later died from the virus, trying to get him to a hospital. An American freelance video journalist for NBC. He is being flown back to the States after also contracting Ebola in Liberia. Officials say he was doing nonprofit work in the country before the outbreak of the disease. Overseas in West Africa, the virus has taken the lives of well over 3,000 people, and some estimates have it at well over triple that amount. Hospitals, they have reached capacity, many people being turned away, and some are being left to die literally in the streets.
They're busy spraying down the area where the person is. They're going to wrap in plastic and take away. He's not dead. He's not dead. They were wrapping him up to take him away, but he's alive.
The first Ebola diagnosis in the U.S. has raised concerns about whether the disease could spread on American soil, even though federal health officials say they are confident they can keep it in check.
Symptoms: fever, 101.5. Symptoms: flu-like illness, so things like headaches, muscle aches and pains, joint aches and pains, nausea, vomiting, diarrhea, abdominal pain.
We see these symptoms all the time. We don't just automatically jump to Ebola. I mean, you hear hoof prints, you look for horses, not zebras.
If it happens somewhere else, it can always happen here. It's more important with something like this that can be spread that you ask the right questions.
Knowing that somebody was able to get on a plane all the way to Dallas in our own country, and we're supposed to be second to nobody when it comes to security, and it's all about security. So yes, it's a little scary.
You know, this is not West Africa. This is a very sophisticated city, a very sophisticated hospital, and the dynamics are so significantly different than they are in East Africa, or excuse me, in West Africa, that the chances of it being spread are very, very, very small.
The only way we're going to get to zero risk is by stopping it in Africa. That's where the battle has to be won.
All right, consistent refrains from the medical community stateside that they've got this under control and don't panic here. Yet you can see increased tension here every day this week, one day after the next, people asking more and more questions. So we're bringing our panel right now: Dominic Carter, political journalist and author; C. Scott Vanderhoff, attorney and former Rockland County executive many times over; and Andrew Whitman, our senior political correspondent. And you know, guys, I just saw a briefing right before this where in D.C. there was a lot of questions. There was some mismanagement, seemingly everyone agrees, in how the situation was handled in Texas initially. But uniformly, they said, let's not make the leap to make what's happening right now in parts of Africa akin to what's happening in the States. We've got this under control. Are we all comfortable that it is under control, or some of the fears? I don't know, you guys. I always find people seem to think people on TV know more answers than we do. I have gotten more questions about Ebola in the last 2 days than I have about any campaign or election or anything else. I keep telling them, I don't even play a doctor on TV. I know why you're asking me. But, you know, you've dealt with other health concerns, maybe not a pandemic, but in assuaging fears, is it most important just to stem panic, or, you know, are they right here that there doesn't really seem to be much concern stateside?
Well, I mean, you listen to your doctor, and the doctors who know how to treat this disease are giving us some confidence that it can be contained. The concern I have, and I think we all have, is what about, you know, the nurse who didn't recognize it right away? What about the pillows and the mattresses that were not dealt with properly right away? It's those small things that may not be part of the medical community as such, but that could cause a problem. And what about the person who's coming in now who also didn't suggest that he might have or she might have contacted us? So there are a lot of issues here. I think the most encouraging news is they're really working on a vaccine that might be available sometime early in 2015.
I don't buy what health officials are saying, Richard. I really don't. I think we have a serious problem right now. And I think they're trying to contain it and stop mass hysteria. But I'm in the camp, and I can't believe I'm saying this, with Senator Rand Paul, when he was I really feel
But there is no evidence to suggest, Dominic, that there's been, they even said today in the press, this was right before we went to air, that there very well possibly could be another case or something. But you heard it reiterated in Texas, it was reiterated today in D.C. This is not Africa. We can treat this.
Right.
And you know what?
It doesn't have to be Africa, Richard. As the county executive said, and this is what my concern is, that individual that got on that plane, the air that was circulating in that plane, I know it can't be passed that way.
So?
But we still don't know all the answers. What if he went into the restroom and I don't know, what if he was shaving when you can't get it?
But my only point is, there's transmission. It's like we had this kind of concerns. I'm not saying it's the same thing. When we've had our first cases of HIV and AIDS here, there is science that says how you can and you can't transmit it. And this is not just somebody coughing and then everyone in the room's going to get it. It has to be direct contact. And Andrew, right here, you can see right at the table, these kind of conversations are also happening at dining room tables. And you saw in Dallas, I mean, I was surprised people kept their kids out of school about this.
Well, that's not surprising. People keep their kids home from school at the drop of a hat if they think there's anything at all remotely to fear. Look, this is exactly the kind of conversation that, you're right, is happening all across America, because very few people are infectious disease experts. We're certainly not at the table, and most people at home aren't. And it's Ebola. It's something they've never really heard of or investigated before. So there's a big rush to try to get new information. That's why it makes breaking news on the 24/7 cables.
Andrew, uniformly, we had an infectious disease expert on with us this week here that we brought on. He said the same thing the CDC has said. He said the same thing the officials both in Texas have said, the state officials here have said. Uniformly, they're saying Ebola is not an easy transmittable disease. Now, if you're in a third world or in an undeveloped country where there's not sanitary treatment here, we saw the report that Richard Besser did with people literally dying in the streets right there. But that's Africa, that's Sierra Leone, that's, you know, West Africa. That's not Dallas or New York City or wherever the case may be. There's a huge gap.
But there's absolutely a huge gap, but there's only so many times that officials can tell you everything's okay, we got this under control, we got this under control, and that information doesn't get out to everybody. The details of why it's under control, of why it's nothing to be alarmed of or over, that doesn't reach everybody with anywhere near the same speed that the questions reach people. So you can try to give those updates as often as you can. There's also something about just an air of competency that needs to come from officials who are in that position.
It was better today than it was yesterday.
And if you think about it, it's like what we saw after 9/11 when Giuliani took the spotlight, because he was the voice of competency in that moment. There needs to be a voice. Hopefully it's the president or somebody at the White House, but certainly the medical officials who can tell us, and that's who people are going to turn to.
Just one thought, though, and I think that's important. One of the real problems here is not Ebola. It is the fear of Ebola. It is the mass hysteria. People pulling people out of schools, what have you. So one of the really critical things for any government to do is to make sure that you're out there and giving confidence that you have it under control. That's as important as the actual control itself.
This is a broader question. It's not relegated to Ebola. We talked about this earlier in the week. I remember, and this was, I don't know, about 10 years ago, I guess, when the SARS, the bird flu, and there was a real concern. And then we learned here indirectly, well, if it came here, what would happen? Primarily it was in China. And then somebody's like, well, we quarantine. Where would you quarantine? Well, we go to open air stadiums. And then all of a sudden, it seems like news to us Then we heard from local county officials saying, we don't really have a plan for this. How much really has there been planning and drilling? I mean, we did this for Indian Point, for example, right? They went through all that. But I don't remember a lot of drills for this. From the health agencies, you were at the county level, you had to figure out everything from schools to the transportation to everything else. How much real prep is there for pandemics if they ever come to the U.S.?
You plan and you plan and you plan and you set up places for quarantine and you determine how best to control it. But the bottom line in those cases was a pandemic like that could overwhelm not only the emergency plans but all the hospitals. And then you've got done, then you're doing triage.
Yeah.
And that's when it becomes far more difficult because you're trying, and I'm really talking about extremes here.
Yeah.
But triage, when you're actually dealing with those who cannot make it, who can make it, like any emergency scene. So the answer is that there is good planning, solid planning about how to deal with it initially. Do you use community field houses, for example, as we do in major storms for places?
And if I can interrupt, chain of command. I mean, one thing we did see in Texas was, and I even saw it today, they're vesting some authority in the local officials. And I kept waiting for the CDC to say, we're in charge of everything. We're on the, there still is local, I guess state to a certain degree, county might even, and then you get to the federal. How clear is the chain of command when this happens, or is that still a little blurry?
It should be better, and it normally is. In other words, the state takes a certain role, the feds take a certain role in terms of the CDC, but ultimately, and that's where you get concerned that the local officials, whether they be the governor or the whoever is ahead down in the county, must take the responsibility to take instructions from CDC in order to do whatever is required. And it's that piece, you know, when you finally get down the line, even though you may have the correct instructions to do it properly to ensure that, for example, no one really knew that that family had to be quarantined. That was, it came about kind of everybody said, well, gee, you better do this. Well, you can't have that kind of maybe we should do this kind of thing.
And you know what's amazing? It always seems like in this case, one nurse sending a person home that came there for treatment, and again, you can't transmit it until all the symptoms are fully showing, right? So if you're sick but you're not fully showing, you're not contagious or even transferable or whatever. So it just takes one nurse with one person, and then all of a sudden we get these kind of conversations. It's amazing how these things start, and then that's why I guess they call it patient zero. And I want you at home to weigh in on this. We're going to go to Facebook and Twitter and answer a question tonight. Ebola. Are we too worried or not worried enough? You even have a disagreement seemingly at this table on the question. Please make your opinion heard. All right, when we come back, we're going to head out to the campaign trail because, as we said here, we're closing on 4 weeks to the election. And a couple familiar faces are on the hustings, if you will, and they're not running for office this year. I'm talking about Hillary Clinton and Chris Christie stumping very hard for members of their own party. And I'm going to ask our panel here how much that actually helps them if, in fact, they run in 2016.